Welcome to this month's PFA Network virtual meeting. It's great to see all of you on and joining us this month. We really appreciate you taking the time out of your day to join us for these virtual meetings. It's one of all of our favorite meetings of the month, so thank you all for joining. I'm Lindsay Galley. I'm the Director of Education at PFCC Partners and happy to kick off our meeting this morning. If all of you won't mind just taking a moment and heading to the chat box and letting us know who you are, where you're from, and then we can get a really good sense of everyone who's in the room with us today or in the meeting. As always, we are Zooming, so if you are looking at your screen right now, you should see a PowerPoint. This will kind of guide us through our meeting today. And if you have some background noise and need to mute your line, you can go ahead and click the mute button on your screen. Or if you've called in, you can mute your phone, I believe, by pressing *6. To mute. And then if you would like to share your face like Laura and I are doing, you can start your video by clicking the Start Video button. And then also on that toolbar that you hover over, you can find the chat box as well, where you can introduce yourself now, ask questions, and start conversations through today's meeting. But this is always a pretty flexible meeting, and we have lots of time for discussion and conversation with all of you. So very excited about that. And I'd like to say hello to Brandy Hicks. Hi, Brandy. Hi, Dr. H. Good to see you. And welcome, Greg Merritt. Thank you all for chatting in. And with that, there I am. I would also like to introduce Libby Hoy, founder and CEO of PFCC Partners, who is joining us by telephone now for a very busy afternoon, but welcome, Libby.
Thank you so much. Can you hear me okay?
I can hear you good. Yep.
I'm still trying to get online in my car, not while driving, I'm parked. But while I work on that, why don't we go ahead and get started in the meeting? So as Lindsay said, always our favorite day of the month to have conversation with our advisors. And I realize that this time slot may not be the best for everyone. And I would guess that we won't be able to hit on one that's perfect for everybody. But I am open to thinking about whether this should be moved. I know I'm in the car because I'm actually going to visit with the Patient Family Advisory Council here at Rancho Los Amigos Rehabilitation Hospital, and I know this conflicts directly with their meeting. I know it conflicts with a Sutter PFAC meeting, so maybe we can have a bit of discussion on whether we should make a change in the standing meeting time. Any thoughts on that just right off the bat?
Hi, can you guys hear me?
Yeah,
Yes, we can.
Oh, awesome. I'm only on the phone. This is Mike Middleman. I'm calling in from Philadelphia. I'm rather new to the group. The time is a little challenging because it's the middle of the afternoon here in the East Coast. So I'm usually in long afternoon meetings at this point, or sort of traveling in between, but I'll do my best to join whenever I can, whenever I'm free. I know that, lunchtime here on the East Coast usually works pretty well for a lot of people for meetings, 8 a.m. on the East Coast, but that's too early for you guys on the West Coast, and things like 6 o'clock in the evening. You guys aren't all up at 5 a.m.? And evenings tend to work pretty well, like 5 o'clock meetings, 6 o'clock meetings on the East Coast. So
great. I appreciate that that perspective, and you're right. As someone who got up for a 5:45 a.m. my time meeting this morning, I love you all, but I'm not willing to go to the 6 a.m. So thank you, Michael. We'll take that it's always a little bit tricky to get all of the time zones kind of covered. So it's good to hear that either a lunchtime or later afternoon or early evening is what I'm hearing.
Yeah, a lot of people do early evenings on the East Coast because they know their West Coast counterparts are, still at work, and especially if it's like a 6 o'clock or 5 o'clock end of the day kind of thing. Yeah.
Great. That actually might work because most of the advisory council meetings, at least that we're conflicting with, are during the day. Great. Well, I appreciate that feedback. Any others?
Libby, in the chat, we have Katie Kazkamo. I'm sorry if I messed up your name. And she said 9 a.m. works well for me. And where are you located, Katie?
I'm in San Luis Obispo, California.
Oh, California.
So I'm on the same time zone.
Yeah, you're in our neck of the woods. Great.
Great. All right. Well, we'll take that into consideration and put it out to more broadly and see what works. All right. So moving forward, PFCC Partners, as you know, is the organization that hosts the Patient Family Advisory Network. We are a small team with a large vision to reinvent the healthcare industry, so that through partnership, we're improving the quality, safety, and delivery of healthcare systems. As PFCC Partners, as you know, or maybe new to the group, serves and collaborates, contracts with health systems, research teams, quality improvement organizations, national policymakers to construct the infrastructure that supports partnering with patients and families so that all of us and all patients and families can inform the design of our healthcare system. So moving on, as the Patient Family Advisory Network has a goal to really create the sense of community, and I so appreciate all of you again taking the time to come together and think about, what does it look like to be an advisor in a large health system or a rural health system or a small community, an academic center, on a research team, to really share what we've learned in that sense of community. I also know that as an advisor myself that served in this role since the mid-90s, the evolution of patient-family engagement and the opportunity for partnership has just exploded, especially in the last 5 years or so. And I think it's really important for us as a community of advisors to inform even the development of patient-family engagement as a strategy. So that's one of the, I think, primary focuses of the community. And we'll talk about some of the activities that we're supporting and engaged in to further those discussions. The second piece is the skills exchange and the opportunity to share with one another through a peer learning community those things that work and maybe that hurdles that we've all encountered that we're learning how to overcome. We at PFCC Partners are also looking to the field and identifying gaps in knowledge that we as advisors need to have to be effective partners in, for instance, the measurement space. All of a sudden, all measure developers need to have patients and families as part of their technical expert panels and their activities. And so we have put together the measurement basics curriculum for advisors so that we all have, I was going to say you all, but I need it myself, have the context for how do measures get developed and what is a measure and why is it important to the healthcare system. And so we're seeking to support all of you in that capacity building activities. And then finally in the engagement opportunities, and that's we are frequently getting requests for patient family advisors to participate in a variety of activities, whether that's being on a research team, participating in those technical expert panels, like I mentioned, participating on National Quality Forum teams, National Academy of Medicine, We've got lots of people looking for patients and families with lived experience in a particular area, or a research team studying a particular condition, what have you. So as those come in, those are all opportunities for all of you to engage. And the way that we at PFDC Partner staff are connecting advisors with those engagement opportunities is through the PFAnetwork membership survey. So through all of those responses you've given us, we can kind of sort through and see, you know, who's got that particular lived experience and can we match them up? Do they like doing presentations, or they prefer being on research teams? That's how we're making those connections. So really important, if you haven't already filled out that survey and you would like to participate in some of these engagement opportunities, please fill that out so we know who you are and where you are. All right, so the next slide is just a depiction of PFDC Partners overall. And you see at our foundation is the patient family advisor community, all of you and the PFAnetwork. That is the way that we keep in touch with the advisory role, in addition to the fact that all of our staff still serve in the advisory role in a variety of locations that you see in that gray box. So we really think of ourselves as having kind of two customers, if you will. I don't know if customer is the right word, but two populations that we serve. We serve the healthcare system and industry in terms of setting up that infrastructure so that, again, health systems, measurement teams, all that variety can meaningfully engage patients and families in high value and sustainable partnerships. Through those activities, we're able to support the PFAnetwork, which is on the right side, in terms of supporting the capacity building of advisors and the peer learning community that we have here. And then upwards, you see some of the organizations that we're currently partnering with. So next slide, please. I have to give kudos to our wonderful admin, Laura Jackson. I think she's on as well, for creating this heat map. So some of you may have seen the first iteration of the map that we put out in terms of identifying the locations that the Patient Family Advisor Network membership was covering. But Laura took it one step further to say how many advisors we have in each of those locations. So I think this is kind of cool. And it reflects, again, the membership of over 600 patient family advisors that are engaged with the PFAnetwork. So I hope all of you see a green dot reflecting where you're living and serving. Any thoughts on that? I just thought it was so cool.
Good.
I'm thinking that you guys may find it useful to utilize the map as well to understand the breadth of the PFAnetwork that you are members of, and maybe even to take it forward in some of your engagement opportunities, because the goal for the community is really that when I go to National Quality Forum and I'm representing the PFAnetwork, it's not just me, but I have this whole cadre of 600 advisors sort of behind me. So I think it's, I would encourage you to use the heat map to depict the momentum behind the Patient Family Advisory Network and just in general of patient family advisors overall.
And Libby,
all right. And Lindsay, I was just going to say, you'll stop me if there's something in the chat.
Yeah, there's a chat from Greg. He says, it is cool. It's probably good to add to the map that it represents more than 600 advisors. And I believe, Libby, let me know if I'm wrong, is this is from the registry, so it's not a total of those 600. Is that right?
I'll defer that to Laura.
Yes, that's right.
That's right.
So
okay, so then I see. Okay. I'm glad you corrected me. So again, these are then the the folks who have completed the membership survey and who have been engaging in additional efforts. So it would be interesting to put and important, I think, then you're right, to put the key on, because obviously we're confused about it. So great suggestion, Greg, thank you. And if anybody has ideas about how we might get to the broader 600 in order to engage them in this deeper opportunity through the PFA Network survey, I'd be open to that. Anyone?
What's your question exactly? How do you get people? How are you getting people to fill out the survey? Right.
So we have 600 that have signed up for the listserv, and they get the mailings and they get the notices and such. But how do we increase the engagement of those other roughly 350? Oh, my math is bad.
I mean, a first suggestion, I guess, that comes to my mind would be to essentially, I'm hoping I did it.
You did.
Okay. I think it would be essentially to let people understand what the importance of it is. I don't think maybe I didn't fully understand what it is until you just explained it on the phone. But if people are looking to engage, it sounds like the importance of it is that if people are looking to engage with activities such as you outlined on the phone, with the quality forum type things, those are the way you're essentially going to be finding people. So if there's, I don't think I initially knew that's what that was for. So or if I misunderstood what that was for, but I think that would be a good way to essentially ensure that people know what the practical use of it is. I think I get surveys from places all the time to fill out that I get emails from, and they seem pretty useless, and I never do them because there doesn't seem to be much of a point to it. So this one sounds like there's actually an effort behind it, so that's good.
I appreciate that. So it sounds like we could do a better job articulating the value to the membership itself.
Right, in terms of why it's important to do it and what you can get from it, right?
Yeah. And maybe if it's new or newer that you're making this sort of matches, it'd be good to do a blast out just to everybody and see if you get more folks by talking about what you said earlier.
We haven't done that, and you're right. It is somewhat newer. It's definitely expanded over the last 18 months, I would say, but it was because of the request that we developed the survey so that we had a better sense of, who was in the network and what their interests were and their ability to participate in other events. So it is all an emerging practice, I guess you could say. So that's a great plan. I mean, we had, I think we're right at 160 folks who have completed the survey, and I think 12 months ago we were somewhere around 25. So I think it's grown, and these are the kinds of growth communications we probably need to pay attention to a little bit more.
And Libby, there's a question in the chat from Dr. H. Do people come and go in the network as they are currently engaged or not for them? And so I think the question is, do people kind of come to the PFA network when they need it and then exit as they're done with their activities? And I don't know if we have a way to track that.
Yeah, I was just going to say, I think intuitively people come to the PFA network for a variety of reasons.
Yeah.
When we are setting up advisory programs in health systems, we're really encouraging those health systems to send their advisors to the PFA network for the skills building pieces and the peer learning, just so that they get their feet under themselves in the role of advisor a little bit more. So my guess is that there's some drop off there once they've kind of gotten themselves established, and maybe before they're quite ready for more broad-based regional and national kinds of efforts, but we currently don't have a way of necessarily tracking that that activity.
And then
one of the questions I have, can you hear me? This is Brady Hicks. Can you hear me?
Hi, Brandy. Yeah, go ahead.
Hi. So yeah, like Bill said, it might be good to get an annual update, but then I also noted that Greg and some other people, and I actually can't remember if I did it. I hope I did it as well. I just want to make sure. I know it's through SurveyMonkey right now, so I don't know if it would be a way in the future to maybe house it somewhere where people could go back and see as well as update it. Because if it's what I think it was, I don't actually remember what I entered. And I know like priorities and interests may change. So it might be great if we could change it or update it over time. That might be something that would be helpful as well.
Great idea.
That's a great point.
Thank you.
I do update, this is Laura, I do update it weekly. So as we get responses in, if you do send in a second response to the same link I just posted in the chat, I will update your info in our system. So there's that too.
Great. Thank you, Laura. And so with that update, we could go to the next slide and welcome our new advisors into the community. And we've heard from Michael Middleman. It's so great to have you on. I know Carlos is in the meeting that I'm going to walk into, so he wasn't able to join us today. But anyway, always expanding, and we're excited about that.
And I was going to say, I thought I saw Emily Parks is on as well. So hi, Emily.
Oh, great. Hi, Emily.
Hey, so one thing I was going to add, and then my phone started ringing, is as somebody that's new, I think I'm just like, I'm like, yeah, I'm ready to engage, but I'm not sure what I'm supposed to do next. I filled out the survey and I'm like signed up for some online trainings and I'm like checking out Yammer. So maybe that might, as like a new person that I'm not really sure if I'm waiting for something or what I'm doing, that might be something in regards to engagement. But also because I'm like super new, I don't really know.
Yeah, I like that. I think it's a great idea. So maybe a follow up to the welcome message.
Yeah, or like, you know, this is exactly what other people are doing, and how they got there. Kind of like coasting and checking things out right now. So.
Right. Great ideas. So yep, Yammer is one of the areas where we're connecting and having some great conversation. I encourage you to just, I think the best way to get comfortable with Yammer is just to sort of dig in and check it out and look at the conversations and the resources that are continually being posted there. I think we've got, you know, fairly active conversations going on there. So let's see. As we go forward to the slide 10 with the PFA Network Advisory Board, this is another way that we would really like to both raise the capacity of the patient family advisors in the network, as well as build the sustainability of the network and really live true to the mission of creating a community for advisors by advisors. So what we're initiating is an advisory board made up of members of the PFA network to encourage or advise rather the PFCC partner staff on how we can best direct the activities in this community, how we can, you know, establish and deepen partnerships in the broader community of healthcare. So you see the vision statement there. The advisory board will direct the activities, inform priorities, and grow the capacity of the network to be a resource to its members, number one, and then to healthcare professionals. The advisory board members will collaborate with PFCC partner staff to meet the rapidly growing demands for skilled advisors to co-design a person-centered health system. So I just wanted to stop there for a moment and see if there are questions about the advisory board. And yeah, anything?
I don't see any questions in the chat box, but Laura did add the link to the application in the chat, easily accessible for anyone who's interested.
Great. Yeah, and again, this is our team's thinking is that we really want to be a resource to all of the members, and that the members be a resource to one another, so that again, when you are representing either a state or a regional or a national project, that you have this whole cadre of a community behind you. So that's really the effort to resource its own members. And then, of course, the healthcare professionals that are looking for patient and family advisors to partner with them across such a wide variety of projects. So we really want the PFA network to be a high value and, again, sustainable resource for both the advisors and our healthcare partners. We figure we don't have all the answers. We need to open the leadership to the community itself.
Is there a link online with some more information about this and sort of what you're requesting for this by April 8th? And do you have any sort of idea around what the commitments will be for this?
So we do have a tentative charter for this. We'll look to update that once we get an advisory board in place. But yes, we can certainly share that so that you know what the requirements are and the goals of the advisory board.
Okay, I've been participating in the YAM group so far, so I'm new as well. For the other person who mentioned she's new, and I've been trying to understand what's going on in the different YAMmer groups. I know I don't know if there's normally a lot of activity stemming from the organization or if it's sort of driven from folks who are in the different groups. But with regard to this group, I know there's a compensation group. So is this, on that note, is this network advisory board position, does that line up with compensation discussions that I guess are happening in the compensation work group on Yammer?
Great question. And your questions are just giving me so many ideas about how we can better articulate how the PFA network is functioning currently. So the work groups are generated by the advisors, by the members of the PFA network in a particular area of interest. The Patient Family Advisory Network will be sort of overarching all of the work groups and the entire network. So what we are foreseeing and what again is tentative in the charter now is for the advisory board to sort of I guess designate whether a work group will be formed. We do have a charter for the work groups themselves in terms of the way that they've been functioning. That's a new area for us as well. So is that helpful? So the advisory board would be kind of over the work group,
yeah, that's
well
helpful.
As the community.
Yeah, that's helpful. Thank you.
And Libby, I think another, sorry, this is Lindsay, but two things. I believe that we added to the first page of the application on SurveyMonkey more information about the advisory board and the information that we've kind of developed for the charter. So there's definitely more information there. And then Libby, there was another question. I think this was kind of what Michael was asking too about the advisory board role, if that is compensated.
At this time, it is not. The compensation work group is exploring ideas and ways that we could fund the PFA network. Right now, we're funding it completely from contracts that we're working on, which is not a sustainable model. So we also recognize the need and are really pushing for patient family advisors to be compensated when they are engaging in more regional and national kinds of efforts. Whenever we are receiving any kind of funding in order to do the matchmaking and the preparation for advisors, we are passing on a percentage of that to the advisors. So we are working towards establishing what that might look like, but we are actively seeking funding partners for the PFA network. And the more that we can demonstrate the value, the more the stronger the argument for receiving funding that our compensation work group members will be able to take forward, if that makes sense. But to be clear, it's volunteer at this point. Do we have Bev Kreider on, Lindsay?
She hasn't spoken up, then I don't think so. No.
Okay. Okay. So let's move forward, but we are going to have an update in just a few minutes on the compensation work group. In terms of the community. I'm sorry, Lindsay, did you have something?
Yeah, sorry, just before we move from this, Greg just had one more comment in the chat box that I think it will be important to explain why it isn't compensated yet, as I wouldn't want to create any dissonance to the compensation work group. So making that statement clear for the advisory board, sounds like.
Got it. I'm just making a note. And to be clear, the members of the compensation work group are not compensated either.
Right.
Ironically.
Ironically, yes.
They're working on methods. So before we move to that update, I wanted to talk a little bit about the opioid response work group. So for those of you who were able to join our call last month, Patty Black shared a personal story of her family member who was really hitting some barriers to accessing opioids appropriately in relation to her chronic debilitating illness. And so the concern was, again, we had a very robust conversation about not only safe prescribing in terms of not setting people up for addictions, but also, how do we manage those who are experiencing opioid use disorder, as well as how do we ensure that the people who need it and are using it appropriately still have access to it. So again, a very lively discussion, which continued, I think, to some degree on the Yammer community. And what we asked if there was interest in developing a work group around this. Is this an area, again, the work groups are designed to bring together a consensus message that the PFA network wants to take forward into the community. So is there a need and a value for us to make a statement about the opioid response or the response to the opioid crisis? So it was determined that there was a need, that there was a desire, and we've got several folks who are interested in participating for that. So are any of those folks on the call?
Yes, this is Charlene, and I am on the call.
Hi, Charlene, and
Hi.
We are happy to have your interest in participating in the opioid response work group. Can you tell us a little bit about what interests you in participating in that?
Yes, the reason I volunteered to participate with this is because I've over the last decade have had a lot of medical attention, heart transplant, several surgeries, several broken bones. Anyway, in summation, I've had to deal with a lot of pain, and I am in chronic acute pain as it stands today. And I personally have my way of coping with my pain. I have also started reaching out to others in my acquaintances, family, and friends to find out how they're dealing with their chronic and or acute pain as well. And there are two things that have become vividly apparent to me. Number one, pharmacies automatically renew some of these subscriptions, which I found absolutely astounding. Number two, my personally philosophy, and I realize that this would not work for everyone, is to accept the fact that I am going to be in pain and I just need to deal with it the best way I can. And that does not include pain medication. I have several other ways with which I deal with that. However, having said that, I have more recently, the first part of this year actually, been on narco, and I just have another family member, an extended family member, fell and broke a hip and messed up a shoulder, so she is also on narco. So I'm following her rather closely, and so far that's working for her. But she, like me, has a very non-addictive personality. At least I think so.
Yeah.
So. Having said that, I think it's a very, very important issue, but I think there are so many variables that come into this. It's going to be very, very difficult to find a single statement that is going to cover adequately all of what we want to say because of the individuality that comes into play here. But I'm anxious to work on that.
Great. Thank you so much, Charlene. And, it occurs to me that with all of the work groups that have come bubbled up to the surface that we've been working on, they are all issues that have so many different layers to them and so many different perspectives. And I think the common thread is that there needs to be an opportunity to be an individual in the healthcare system. We often talk about standardizing individualized care. So I really look forward to the discussions. I think bringing all of those perspectives forward in the common understanding that they're just acknowledging there are so many different approaches and so many different layers to this problem. We didn't get here in a simple way, and we're not going to get out of it in a simple way. So thank you, Charlene. I appreciate that effort.
Very true. I just wanted to add just two more very quick comments. Number one, we are just so complex. It would be simple if we were just all the same, but thank heaven we're not.
Wouldn't it?
Yeah, and in summation, what I'd like to say is it really comes down to the individual. Okay, now I will relinquish the floor. Sorry.
Not at all. That's what the virtual meetings are for, discussion. So I appreciate that. So if anyone else who is listening is interested in participating on this opioid response work group, we'd be happy to invite you in. It occurs to me that you're wondering already, I can hear Michael asking, well, what does that mean? What does that look like? What's the commitment? Those kinds of things. So I think we'll also publish, and Laura, I'll ask you to help me keep up with the notes and the follow-up that we're going to do. But we'll also publish the framework for the work groups and sort of how they get established, what's expected, the time-limited approach, those kinds of things. So we'll get those out and publicized. Boy, we have a lot to share.
And
all right,
Libby, this is Lindsay. Katie, who has joined us, is interested in participating as well.
Great, fantastic.
Libby, this is Harvey Hellerstein here.
Hi, Harvey.
Going back to your map of where our network is across the U.S. and into Canada, and to double up, excuse me, double up on what Charlene said, individual, and what you said, an individual. We've heard, across the United States, the epidemic, but each state is handling it very differently. And healthcare professionals are handling it differently. I know pharmacies here in New Jersey are not so, not my own personal experience, but when I do go to area meetings, that they aren't so open and physicians aren't writing for endless refills and seeing the damage that healthcare providers themselves have put society in with this opioid scenario.
Mm-hmm. Yeah. We always have to make space for the uniqueness of each state and each region. Absolutely. It just, again, if we can come to some consensus messaging and at least have the patient and family voice informing those efforts, I think that's a really important function of this group.
Yeah.
Great. All right. So I'm going to just, we'll keep going the way we are. So Lindsay, do you want to share a little bit about Measurement Basics?
Sure, yeah. So this Friday, March 15th from 2 to 3:30 Pacific time. I know that's a hard time for a lot of you East Coasters, but we will be presenting the Measurement Basics training for patient family advisors. And it's really a high-level look at the measure management system based on the blueprint that the Center for Medicaid and Medicare Services put out. And just a really high-level look and really trying to provide patient family advisors a better understanding of the healthcare measurement system. And then for those patient family advisors who are looking to participate in engagement activities involving measurement down the line, which is going to be an increasing demand for patient family advisors in measurement. We'll also share some ways of how advisors can be involved in the measurement life cycle and what areas where we can really have an impact. As Libby mentioned, this is kind of a growing field for engaging patients and families. And so we're really excited to be able to put together some information to start the conversation with advisors in terms of measurement. And I know, again, that this is very late on a Friday afternoon or evening for the East Coast advisors. So we're also going to be presenting this at another time earlier in the day, more towards the summer. So look out for that information if you're unable to make this Friday's training. Are there any questions about the training and what to expect?
Great. All right. Well, we hope that you can join us. We are being mindful of the East Coasters in the future, so we'll look for an earlier time slot. But I can share that the Center for Medicaid Medicare Services, which funds a lot of improvement work, is very focused on patient-family engagement as an overarching strategy. And so they have put forward several proposals that folks have responded to about how they will engage patients and families in the future. I can tell you that PFCC Partners has responded to several of those proposals, and in every one have included funding and budgets for this kind of effort. So those of you who are interested in participating in technical expert panels, those will be associated, they will have stipends associated with them. They're largely done virtually, which makes it easy for you to engage in, and So we're really excited about this new frontier for engaging. And for me, it's kind of measurement. Oh, I don't know what that is. I'm not a data person. I don't really, data and I don't always understand each other. But the opportunity is to take our lived experience and say, what's really important to somebody who's living with mitochondrial dysfunction is to regenerate their lung function. So how do are we even measuring lung function as a primary quality of life measure? Is that something that's being looked at? So that's the opportunity we have to sort of influence what gets measured, what's important to us, how do we define quality in our lives and in our healthcare. Mm-hmm. So I hope that you will get excited about that as well. I'm getting excited about data, which is a totally foreign concept to me, but I do think we have a really unique and strong opportunity to influence the direction of healthcare with that. So.
Yeah, and this is Lindsay. I completely agree. And I just wanted, because there might be other advisors who are a little bit intimidated by measurement. And I was extremely intimidated by measurement when I started developing this curriculum. So this training, it's coming from PFCC partners' perspective and understanding of measurement, which I had no clue about less than a year ago. And so we're still constantly learning and developing our knowledge of measurement in the healthcare system. But Libby and I have worked on this curriculum together to make it not so intimidating, I'll say. Measurement as a whole.
As with all the PFCC partners training.
Exactly. Yeah. Exactly.
They're very hands-on, very practical, and yet we've had wonderful partnerships with National Quality Forum and with Measure developers to ensure that the content is correct.
Yeah.
Yeah. So great. All right, then moving on to the success story template. Is that where we are, Lindsay? Just double check.
That's where we are.
So we worked in the Hospital Innovation Improvement Networks a couple of years ago, and we still are now, but at the start of it, there was a success story template created that was geared towards capturing successes of patient-family engagement as hospitals and health systems and all kinds of folks were grappling with how do you engage patients and families effectively in your work. We wanted to capture those success stories and sort of highlight those. So we've taken that template and modified it a bit. Again, this is another space where hospitals and health systems and researchers and folks are being asked, tell us about your success with engagement. But very rarely are advisors being asked, tell us about your success with engagement. And I know for myself, there have been times where I participated on a particular research team where the research team highlighted our engagement practices very high, and I rated them very low. Nobody asked me, but I would have rated them very low because I didn't feel like I really had an opportunity to influence. I felt like I was rubber stamping a lot of things. So that disconnect, I want to ensure that the patient family advisor has voice in those success stories and what does successful engagement look like from the perspective of advisors. So I would invite you to check out the template, think about your partnerships locally, think about those things that you get excited about. What do you feel accomplished that you've accomplished or that you're moving in the right direction on? I think there's so much opportunity for peer learning in this community. So I'd like to, we wanted to kind of capture that in a bit of a standardized form. So I would love all of you on the call to take a look at the form, see if it captures what we're trying to capture, which is a quick snapshot of a success with the contact information for those who were really involved in it. I would invite all of you to share something you're proud of in particular. It doesn't always have to be outcome related. It could be, boy, you learned this big lesson in the middle of working on a lean team. or so think about the process of your engagement as well. Any questions about that?
After you write this, where does it go?
Great question. Get us thinking so much. So what we're asking is that we collect those success stories, and we'll post them on the Yammer community for everybody to be able to have access to and to learn from and connect with. And then I have ideas that I would like to take to the community in terms of maybe creating some sort of website library, if for lack of a better word, a virtual library of these kinds of success stories in bucketed areas. But that's something I would want to discuss, on a future meeting. First, I want to see if the form works for people and if people are interested in sharing those successes. But I guess you're right. We do need to have a direction in terms of where they're going to be posted. So for the short run, they'll be posted on Yammer and shared among the community members. In the future, I would look to how we could share them more broadly.
And does one have to follow this template to write a story?
The value, I'll answer it this way. The value of the template is that it captures the highlights of the story without a lot of in-depth reading on the parts, and it's intended to be a connector. So I read this, somewhat brief overview of a success story, and I have Emily's contact information so that if I wanted to learn more about it and what we really learned, I can contact Emily and get the deeper story. Does that make sense?
Yeah.
So I think if the intent of the form is helpful, or is met rather, then I think it could be, taken in a lot of different directions. I think I'd also be open to, if someone wanted to, kind of complete the template and add an additional narrative, they'd be happy, welcome to do that.
Okay. Cool. I might have something.
Nice. And this
Great.
is Lindsay. I also think, going back to your point earlier, Emily, that some success stories like this could be really helpful to new advisors as well, to see kind of the progression of how an advisor got to that partnership in the first place. So being able to see what that looks like and then being able to connect with those who are doing it, I think could be really beneficial for new advisors. But I think we're just getting started to collect some of these stories, so I'm excited to read them and share them.
Great point, Lindsay. Anything in the chat box or anything on the success story template?
Not on the success stories. Great conversation going on about measurement and system change. And Harvey asked if we explain more about getting onto Yammer. We did kind of skip over that because we only have a few minutes left, but if you aren't on Yammer and would like more information, definitely reach out to myself or Laura. We'll put our information in the chat box. I know we're getting low on time.
Great. And with that, if you want to give an update, Lindsay, on the HIT PFAC, that'd be great.
Definitely. Okay, so the National Health Information Technology Patient Family Advisory Council was created out of a work group, actually. It was a patient access work group where we were looking at needs for patients accessing their care, and we found this natural partnership with the organization Open Notes. And so they are more of a movement. They're really encouraging all physicians and healthcare professionals to open the notes that are available to patients and families for their physician visits. And so we have, as an advisory council, supported Open Notes in their mission. And now we're kind of moving on to the overall electronic health record systems and patient portal development. And our current project, we are looking to create the perfect patient portal. And so this is where we need your help. So as an advisory council, we have about 11 patient family advisors who are participating on the council, and they've all completed this activity where we're looking for some of the best features of your patient portal, some of the worst, and in an ideal world where you have no restrictions and unlimited resources, what does your perfect patient portal look like? And so right now we have just a Word document activity that can be taken and filled out and then sent back to us that should be on Yammer. If it's not, I'll double check and make sure that that's on Yammer. But we also have an electronic version coming soon. It's more like a survey. You can just type everything in the in your computer online, and that information comes to us. The outcome will be the gathering of all of this information from multiple different patients who are using multiple different patient portal and different vendors to create what looks like a perfect patient portal in the eyes of the National IT PFAC and the PFA network. That will then be used to share with vendors to support them in making changes to the portals that are currently out there to make them more useful to patients and easier for patients to access. So that's our current project that I would love the support of all of you to help out with that activity.
Great. And moving on from onto the compensation work group, we have newly appointed co-chairs, Seth Ryder and Joe Connell, have taken over leadership for that work group, which is fantastic. We encourage that. I don't think either of them were able to join today, so I'll just give an update on the activities in the compensation work group right now are twofold. One is seeking funding for the work group and the activities of the PFA network. And the second is, excuse me, I lost my train of thought. I coughed and I lost my train of thought. The
summit and the funding opportunities?
Yeah. So, I'm sorry. And then in addition, the funding is in a summit coming up this year. But the other line is to create a second set of recommendations. So they've done the environmental scan, and they're working on some guidance for the conversation and really encouraging organizations to start the conversation about how they're going to compensate patient family advisors. So that's the other. Sorry, what's that? And then very quickly, we have some current engagement opportunities. And Lindsay, I'm going to ask you to go through those as I get on the move to the meeting.
Okay, no problem. And maybe Laura might do a better job at explaining a few of these. I know you've been working more on the engagement opportunities.
Yeah, so the first one, the RAND Corporation, they are looking for patients and caregivers that have recently or are receiving palliative care services. And you can just contact Mary Lou at that email or give her a call and she will give you more information. They're going to be one-on-one interviews with in person or over the phone. They are a research group, so they want to get to know more about that. The Committee on the Future of Nursing 2020 and 2030, that is an online webinar and on March 20th. And they'll also be at the Academy of Sciences in DC, so if you're in that area. And then PCORI is having their annual meeting in September, and they are, I believe, still offering scholarships for patients and caregivers. You can go onto the website, and they have a flyer for that.
Awesome. Thank you, Laura. And just to confirm, all of this information is on the PFA Network website as well, right?
Yes.
Yeah, so you can find links and more information there.
Oh, Greg says that the PCORI scholarship is due tomorrow. So if you want to apply for that,
get on it.
Get on it.
So you want to make sure you click on the patient scholarship when it's due on the 15th, and make sure you it is very competitive. So make sure you write something interesting. Can I ask a question about the compensation work group and all these work groups? Do they actually meet other than just like discussions on Yammer?
Do they what? I'm sorry?
Yeah.
Do they meet? Like, how do you get on one?
They meet virtually. So we have monthly meetings where we're, producing what the group decides to produce from the environmental scan, and then continue discussions. So anyone who is interested in joining is welcome to do so. Just send myself an email and express your interest, and we'll get you the login information for the virtual meetings.
Okay.
Has anybody been to the PCORI thing before?
I've been. This is Mike. I've been a bunch. I'm an ambassador for PCORI. If you can attend, it's a very worthwhile. It's a couple of days long. It's one of the longer summits, but everything is paid for. If you do get a patient scholarship, your airfare or train ticket would be covered. Hotel, a lot of meals are included, but you also get a per diem. So you shouldn't have any out-of-pocket expense, which is great. They do have rest areas usually. Very patient-friendly conference. It's sort of built around patients, and it's a great opportunity to interact with people. So I'm a big fan, and if you've never been, you should definitely apply. They love first-time people.
So what are the benefits of going? I'm just not, also I don't know even what PCORI is.
Sure. Yeah, PCORI is the Patient-Centered Outcomes Research Institute. So I would recommend you look up the website. We can connect offline if you'd like. Feel free to I'll put my info in the chat box here, and so we don't take up anyone else's time. But I'll just put a phone number from myself in the chat box. Okay.
Okay. Cool.
So,
yeah, and it looks like there's lots of folks who have attended before, so lots of people you can reach out to for tips and more information.
Oh, cool! I'm in DC. Great. Thank you, everyone.
All right.
thanks.
Any other
All right. Great meeting,
questions?
everybody.
Nope. All right. We're definitely over.
Thanks so much, everybody. Send your ideas. Keep them coming.
Yep.
Bye.
Thanks, everyone.
Bye-bye.
See you next month. Bye.
Bye.